Access to healthcare. A general practitioner, GP, is the first doctor you will usually visit when accessing healthcare in the UK. You may have registered with a GP before you were granted status. When you are taken into the care of the local authority, within 28 days you will receive an initial health assessment with a doctor, and they will check your overall health and help to action any areas of need. You can access the following services for free: general practitioners, GPs, also known as family doctors, hospitals, maternity or sexual health services, dental services. The NHS provides services to those who need medical treatment and can also help with contraception, family planning, healthy eating, and mental health. Your health will not affect your immigration status or affect what NHS services are available to you. None of the people who work for the NHS, including doctors, nurses, and interpreters, will pass on any information about your health to any other person or organisation outside of the NHS without your permission, except in very exceptional circumstances, such as if the doctor believes you may be of harm to yourself or others, or if you are under 18, so considered a child. To see a GP or nurse, you can make an appointment in person in the GP surgery, by telephone, or online. You can ask to see a male or female GP or nurse, and your GP surgery will do their best to accommodate this. You may have to wait a few days for a non-urgent appointment. If you think you need to see the doctor urgently, tell the receptionist when you make the appointment that you need an emergency appointment. You will be seen that day if appropriate. There are also urgent treatment walk-in centres, where you can get medical help when it's not a life-threatening emergency, e.g. broken bones, stomach pain, high temperature, or emotional concerns. If you need an interpreter, you must tell the receptionist when you make the appointment. Tell the staff which language you speak, and they will book an interpreter for you or get an interpreter on the phone. Emotional concerns range from the worries we all experience as part of everyday life to serious long-term conditions. Anxiety, post-traumatic stress disorder, and depression are the most common problems. If you have been feeling depressed for more than a few weeks, or your anxiety is affecting your daily life, make an appointment to speak to your doctor. It is also good to share any issues with your social worker, PA, and carer. If you or someone you know has an accident or a sudden serious illness, you should go to your nearest hospital with an A&E department, which is free for everyone. If it is an extreme emergency, call 999 and ask for an ambulance to transport you to a hospital. This service is free of charge and should only be used in an emergency. Sexual health services are free and available to everyone, regardless of sex, age, ethnic origin, and sexual orientation. Sexual health services are provided by GPs and specialised sexual health clinics. You can visit any sexual health clinic. It doesn't have to be one in your local area. For sexual health services, you do not have to give your real name or tell staff who your GP is if you do not want to.